Squatting is a concept in urban life that usually brings to mind very vivid images of visibly unstable and volatile housing, ramshackle structures, overcrowding, slums. While these concepts certainly relate to the topic, squatting is often not as visible, and because of this, not as easily understood. In this video, our aim is to understand the concept of squatting in a different light than what most would. We want to understand how squatting relates to the concept of residency and the services that might be contingent upon that. Formally, the type of less visible squatting we're going to focus on in this video is defined as the residential use of flats in public housing estates without formal permission. Milan is one of the wealthiest cities in Italy. Even as an Italian native, finding an apartment to rent here is as difficult as it can be in any other major global city. But for those seeking state support, it can be even harder. Our area of focus is San Siro, one of the less sought-after neighborhoods in the city, with a higher rate of petty crime and underdevelopment, despite its proximity to the city center. At the heart of the neighborhood lies the Quadrilatero, recognized on the map by its orthogonal grid of streets and blocks. This area was developed in the 40s mainly as social housing and constructed from cheaper wartime materials. Today, of the 11,000 people living in the neighborhood, about 50% are immigrants, mostly coming from North Africa, but also Yemen, Peru, the Philippines, and Romania. In total, there are close to 85 different nationalities represented. In Italy, property is one of the most important assets when it comes to maintaining social protection. After the Second World War, the state invested in several social housing programs to provide housing and employment for the most vulnerable segments of the population. However, a combination of factors has weakened the affordability conditions of the rental market, causing an increase in evictions and informal dwelling. 1992 saw the repeal of the fair rent policy, which liberalized the rental market but consequently resulted in an increase of rental values in urban centers. The 22% decrease in housing stock caused by the Law 560 of 1993 and the freezing of the Just Cal Fund both contributed to a substantial contraction in public and social housing production, resulting in an overall decline in the system and a reduction in its capacity to absorb the growing and more diversified demand for non-market rent. In addition to these policy changes, demographic aging, single-earner households, the discontinuity of labor income, and the migration phenomenon are also factors that lend to the difficulty in housing inclusion. This decline of social housing policy over the years presents itself in the San Siro neighborhood in the form of a large amount of legally deficient apartments. Public housing companies could not afford to maintain the quality of the buildings, leaving many dwellings empty as they don't meet standard living requirements. These vacant flats, coinciding with endless waitlists for affordable housing, create an attractive environment for squatting, leading to the legal occupation of almost 800 empty flats. That's about 1 in 7 of the 6,000 social housing flats in the neighborhood run by the organization ALER. This type of informal dwelling results in a lack of formal residency status, and we want to find out how this affects individuals' access to services in San Siro. In an effort to better understand how the consequences of the lack of residency presents themselves in the neighborhood, we gathered privileged witnesses to investigate access to 3 important services: healthcare, education, and garbage disposal. People who lack residency lack access to parts of the healthcare system, such as public hospitals and general practitioners. To understand the consequences for people who can only officially access first aid, we interviewed Marco Latrachina from the NGO Emergency.
Il problema sanitario è soprattutto persone che non hanno accesso a nulla, quindi sia le persone senza permesso, con un permesso, che non hanno ancora avuto l'assegnazione di un medico STP. Quindi loro in realtà l'unica strada che hanno per avere una cura è di andare direttamente in pronto soccorso.
In Milan and in the rest of Italy, the organization Emergency has two streams of projects, which focus on social protection and healthcare, respectively. In San Siro, we visited their medical truck, which is an expression of their health project.
Ha a bordo medici, infermieri e psicologi e dà una prima risposta a un bisogno molto materiale, quindi una persona che va lì e ha un problema sanitario. Dà quella risposta materiale, quindi banalmente lo visita, ma poi si occupa di agganciarlo al sistema sanitario.
The health services offered by these kinds of organizations are a way of identifying informal inhabitants and putting them on a regularization path.
Adesso vediamo tutte le tue problematiche e una a una proviamo a risolverle per far sì che da una parte vulnerabilità riduci l'esposizione al rischio, quindi ti trovo un lavoro con un contratto, vediamo se riusciamo a regolarizzare la tua situazione abitativa, risistemiamo i documenti e dall'altro ti aggancio a un sistema che se hai un problema, servizi sociali, l'INPS, misure sussidi disponibili, così nel caso tu sei già agganciato e non hai più bisogno di noi.
Early childhood education and care lays the foundations for important quality of life factors such as education, well-being, employability, and social integration. However, public education for children between 0 to 6 years is virtually inaccessible for people who lack residency. But in San Siro, several nonprofit organizations are trying to change that, particularly with their accessible and inclusive learning enrichment programs for children. Mario Brillante, director of Ricetta QB Selinunte, tries to highlight the situation for us.
Qui c'è una percentuale di bambini molto alta che non accede ai circuiti prescolastici, vengono così chiamati. Quindi che cosa succede? Succede che abbiamo una grossa fetta di popolazione di origine straniera che abita questo territorio e che giunge qui quando i bambini sono magari molto molto piccoli o addirittura appunto magari sono famiglie che si trasferiscono e i bambini nascono direttamente qui a Milano. E questo che cosa comporta? Comporta che hanno poche interazioni, soprattutto a livello linguistico, no? Con altri minori della loro stessa età, e quindi non sviluppano le competenze linguistiche di italiano, e questo poi si riverbera nella loro istruzione durante tutto l'arco della scuola primaria e purtroppo questo incide anche sul tasso di abbandono scolastico, l'insuccesso scolastico, proprio perché sono lacune che poi spesso la scuola non riesce a colmare se non accompagnata e supportata da altri servizi come appunto attività specifiche quali il potenziamento della lingua italiana tramite corsi L2 rivolti a bambini con insegnanti specializzati in quel tipo di attività.
Another problem informal dwellers face is the difficulty in obtaining information and access to the services available to non-residents, for example, school enrollments.
Nonostante questo, rimane comunque un meccanismo che di suo è un po' discriminante, taglia fuori una fetta di popolazione, quella fetta di popolazione che non è smart nell'uso, no, di questa strumentazione digitale. Banalmente, prima parlavamo delle persone che, come dire, magari risiedono qui abusivamente, spesso sono persone senza permesso di soggiorno, quindi non hanno accesso allo SPID, quindi non possono fare la domanda di iscrizione telematica.
Language barriers and lack of access to preschool services do not only affect the children, but also have an effect on the rest of the family.
Spesso questo impatta sulle mamme, perché comunque questo è un territorio dove sono tanto le donne che si prendono cura, diciamo, della famiglia, di portare avanti anche il processo educativo dei minori.
In San Siro, there is prevailing visual evidence that the garbage disposal system doesn't work as smoothly as in the rest of Milan. The collection of trash is dependent on holding a formal address, and because a significant portion of the neighborhood does not, the collection system doesn't function as it should, and the neighborhood becomes littered, which creates a stigma. We got to hear from the perspective of the company managing the local waste disposal, AMSA.
The phenomenon of increased waste production in San Siro can be attributed to several interconnected factors that characterize this area of Milan. The main problem is not so much excessive waste production, but rather incorrect waste management. it should be emphasized that all residents of San Siro have access to the services provided by us, and where there are difficulties in waste management, we face a greater workload than the established collection frequencies. However, for some citizens, the main difficulty is to request a dedicated pickup service where it is necessary to fill in the mandatory fields of residence or domicile required for registration, and so they opt for irresponsible abandonment of such waste in unauthorized places such as streets, parks, or public areas. To address this latter issue, over the last 2 years, our company has actively collaborated with Aller and the municipality of Milan to implement targeted interventions and multilingual awareness-raising campaigns. The situation in the San Siro district can benefit from further improvements through targeted actions by many actors and specific interventions on the management of street vendors and illegal dumping.
We've come to understand that lack of residency often hinders access to services in San Siro. However, there are also many organizations that try to compensate for this difficulty. Many notions related to residency are entangled, such as housing, health, employment, tax, and garbage disposal. This creates a complicated circle where certain aspects are contingent on others. This cycle often has negative effects in San Siro when it comes to individuals' quality of life and their integration into society. Another complexity we've encountered is communication. Oftentimes, there are services accessible to those without residency status, but the difficulties in finding and accessing them, often stemming from technological and language challenges, lead to their underuse.